Welcome everyone who joined us on LinkedIn, on Facebook today. I'm Tamás Békási, Business Creation Project Manager at EIT Health Rise. And this is again, Rise to the Challenge event. We decided to continue our series with an episode focused on the power of AI and its future application in healthcare. Why we do that? Because first of all, to explore ways to start using AI in healthcare and provide you with more information about EIT Health's Hello AI Risk program, which trains future talents to solve AI application issues in healthcare. And secondly, of course, to start to give you information on the startup journey, which is a lifelong learning course. And we would like to get in touch with you guys, help you to choose the right in EIT Health education program, and support you in your development. EIT Health is funded by the EU and its most powerful network of healthcare innovators and investors. If you are go-getting innovators interested in healthcare, that you are in the right place now to watch our discussion today with Richard Zsamboki. I would like to remind you that you can ask your questions through Facebook or LinkedIn. And if you are interested in any of our education programs, please visit eithealth.eu or innostarted.eithealth.eu. Or if you're interested in Hello AI Risk program directly, then please come to helloaionline.com. So today's guest is Richard Zsamboki, data scientist at GE Healthcare, and which is an EIT Health partner in Hungary. Hello, Richard. Thanks for joining me today.
Hi, Tamás. Happy to be here.
Richard, AI is called the hot technology of today, and it is hard to learn it for a non-data scientist and engineer. Is it like a new language? So how can we imagine that if you're out of any type of engineering genre, are you able to learn it?
So it highly depends on what you studied and somewhat on where you studied, because in the recent years, in most top universities, AI became part of the curriculum. So if you are lucky enough to study in a program where you have AI built in, it's good for you. Then you already have the basics. But if not, I think most of the engineering students will have all the background in place. I think there are three main pillars and to start in AI. One is mathematics, most importantly linear algebra. Second is statistics or any type of basic machine learning methods, and the third is programming. So the third one is kind of necessary today to work in AI, to have programming skills. I hope that in some years, in 5-10 years, programming will become less and less important, and it will become programming free. There are developments on that, but currently you have to learn programming, and these three are part of engineering curriculum everywhere. For non-data scientists or non-engineers, I think the mathematics part can be built on high school mathematics even. So it's not that big of a leap. So you don't need the most advanced engineering mathematics to work in AI. But you cannot skip the programming part. But fortunately, programming is such an available knowledge today. There are dozens of ways to learn it, and the programming language used in AI, the Python, is one of the easiest to learn. So it's not it's like a new language, but it's not the hardest language.
Yeah, it came to my mind that it's a kind of analogy. I'm not sure you agree with me that if you are learning Latin languages, so for instance, you learn Spanish, then you don't need to restart entirely if you want to learn, for instance, Italian. Am I right? So can we use this kind of analogy for somebody who is actually learned some mathematics, learned some basics, but not a data scientist or an engineer by nature?
Yes, definitely. So as the more basics you are familiar with, the easiest is to pick up data science.
Yeah. And if we are focusing on specifically AI in healthcare, that I remember that you came from the automotive industry. What was the main purpose and the main benefits of continuing your journey in healthcare? So why did you choose to change the industry entirely? It's a totally different thing. So what is your view on that?
So to be precise, I started with healthcare in
Oh, okay.
university because I was mainly interested in medical imaging devices, and I even picked up courses in medical imaging devices, medical devices, and played with the thought of becoming a medical engineer. So that was I was on the verge of becoming highly involved with medicine, but I became an electrical engineer instead, and started working in an automotive industry, because at that time I didn't even know that you can apply for data science jobs in Hungary. And even this automotive startup company I worked was kind of a surprise for me. Someone suggested it. So, but I was very happy to start my career in that place, because one key difference in automotive compared to healthcare is that the data is plentiful, the tasks are not that complex. So some of the tasks are not that complex, so you can participate in a lot of projects, and you can go through with a lot of projects, a lot of new skills you can pick up, and I could do that. But for me, healthcare was the goal. To work in healthcare, and when I realized that GE Healthcare actually works in AI and has a AI personnel in Budapest, that was also a surprise, and I discovered it by chance that one of my colleagues from that automotive company left for GE, and it was a matter of months that I followed him here, and I'm now happy to contribute to medicine, to the medical devices, because I think that of course, after the doctors and all the medical personnel, the engineering part, the engineering background of healthcare becoming more and more important. And in the engineering, software and data science is becoming more and more prevalent and more mainstream, and it is everywhere. AI is not everywhere currently, but it will be. It won't take much year that you will see AI everywhere. And I think that by contributing to medical engineering, to medical devices, you can enhance the life of people everywhere without actually working in medicine. Because I know that a lot of the doctor, being a doctor and being involved in medicine is not for everyone. It's not for me. So I was scared to learn anatomy and to learn all these things. But I wanted to contribute. I wanted to enhance or medical work, and you can do that as an engineer. So and I think it's a very very positive thing for engineers everywhere, that even if you are scared of biology and anatomy, you can make similar contribution and similar improvements.
I see it. Can we consider this as the biggest benefit? I mean, becoming part of the healthcare, medical imaging, data scientist part, to have this kind of social benefit, this social contribution?
Yes, so definitely. So the data science part is currently the it's. So I know that not only data scientists work in medical devices, and I don't want to make all the work seem less important, because I know that a lot of engineers and hardware engineers and software engineers work on medical devices, and they are as important as data science is. Data science is just happened to be the hype today, because that's the future, because
Definitely. Just connecting to your words, in a recent survey, which was created with 22,000 adults in 11 countries, 53% of the respondents said that they believe in automation will significantly change or make their job obsolete within the next 10 years. But the majority of these people, actually 61%, were positive about the impact of technology on their day-to-day work, and moreover, 77% of people said that they would learn new skills now or completely retain to improve their future employability. What's your opinion on that? So how AI and how automation in general will change our surroundings and job circumstances in the upcoming years, and what type of, let's say, personal improvement, skill-related improvement would be necessary from most of us?
Yeah, first, I was very happy to hear these numbers, because I know that this is a question for quite a few years now. Even in 5 years ago, 6 years ago, you could hear these voices that, oh, AI will absolutely make us obsolete and it will destroy a lot of jobs. And these numbers are much more positive, because as we learn AI and as the general publicum understands AI more and more, they realize that it's not an ultimate magician that will do every job, and everyone will be out of job in 10 years. So I'm happy to that people realize that it's not that. So the effect of AI in jobs and the different jobs is very dependent on the on what type of jobs we are talking about, the sector. Because for example, in healthcare, because we are mainly talking about healthcare now, the effect of AI in healthcare will be mainly positive, because I don't think that it will make particular jobs obsolete. It will make tasks obsolete. It will make particular tasks obsolete.
Yeah.
But these tasks are mostly the tasks that contribute the most burnout in a lot of personnel. So, you know, the checking of medical images, a lot of administration, there's a lot of manual labor. You have to, for example, in a radiation therapy planning, it takes hours to mark every important thing in the images by hand, and it must be done by doctors, and this doctor, by doing this for hours, these hours are taken from other patients. Because the doctor could work with the patients, could treat them, could work on more important things than looking at images and just coloring pixels. I don't say that it's just coloring pixels. It's very important, but this is one thing that AI can do, and by doing this, okay, this task will become obsolete, but the AI, the medical personnel will get back the time, and it will enhance their other tasks, and they can focus on other tasks. So in healthcare, the effect of AI will be very positive, and of course you will need to pick up new skills, because doctors will need to at least use AI algorithms, and it will mean some skills to be picked up, but it's not like they need to be a data scientist. They need to be a proficient user of AI algorithms, and that's very similar to any type of learning a new program, learning a new application. So in healthcare, it's very positive. In other sectors, there will be some minor issues, I guess, because there are sectors where AI can make can make jobs obsolete, but that's a question for the future, because I don't think that in the coming few years we will come to that.
Yeah, and let me underline this fact. So whenever we're talking about cross-sectoral approach, of course, how you mentioned, maybe in some sectors, the obsolescence of the jobs will be higher than others. But these kind of, so the workforce which will be space, which will be empty, let's say this way, can be transferred to other industries. And just to focus on still healthcare, based on the recent report of WHO, by 2030, we will have like 40 million healthcare workers need to be added to the system, and currently it shows almost 10 million personnel actually from healthcare, which will be missing. Of course, AI can partially fulfill these kind of expectations, but definitely we need more healthcare workers also as a human resource in the system. So definitely wherever AI is making some task, how you mentioned, inefficient or actually just not necessary, then other industries can utilize that kind of workforces. So that's pretty much the circulation we can observe right now.
Yeah.
And
it's not the first time we do this in history. You know, it's at each of the industrial revolution and even recently when the internet became a thing. This always happened, that it was a circulation in across the sectors.
Yeah, and I'm not sure you're familiar with them. I would be interested in your opinion on this point, that there are many theories that actually nowadays we are not heading to the industrial revolution we had in our history so far, but gradual change and gradual revolution. So it's not a big step like we had in our history. For instance, whenever the machine revolution, let's call this way, happened, but we are slowly but surely getting into a new industrial revolution year by year, but it's more gradual, it's more slow process than we had in our history. So I'm not sure you are agreeing with this observation.
Yeah, I kind of agree, because even in these years we saw that first in automotive and a lot of business areas AI appeared, but it took years to get a foothold in healthcare, and even now it's not the mainstream in healthcare. So AI and data will conquer the sector by sector the industry, because we see and we experience that wherever data and AI appear, it makes big changes, and it's our pathway to the future.
Absolutely. Yeah, and let me underline one other things you mentioned previously. So the role of education, because I totally agree, and this is pretty much what industry altogether says, that doctors, researchers should not become data scientists or AI experts, but at least they need to be familiar with the technology, and they need to be as a kind of user in the system. So who is not familiar with Hello AI Rise, I would like to highlight here that what is the program itself. So that's a joint program funded by GE Healthcare and EIT Health together for scientists, students, so everybody who is actually in the healthcare field, even if it's a student, researcher, doctor, or a senior expert, but would be interested in AI, so medical imaging and the utilization of AI in healthcare, we would be more than happy to host in our training program. So Hello AI Rise is an online training. Of course, nowadays we can only talk about online trainings. In the good old days, in the past year, of course, we had it not an online way, but today we transferred this program to online world as well. And here, like Richard from GE Healthcare, experts who are actively working with AI in the healthcare field can teach you as an applicant or a participant how to use and how to utilize actually this kind of knowledge. There is also a programming module. So if you are not into programming, so you don't have the basic programming elements, you can also learn under this program. As you can see in the slide, the application is open till 28th of May. So if you're interested in, I would really encourage you to come to helloaionline.com, or you can also see the direct application link here. So that's, and I can tell you, so for all the audience who would be interested in this program, that last year we had around 800 applicants, and we selected around 500 participants. This year we would choose a little bit more, but we are really proud of that. This program is really popular, and even though we had the first edition the last year, there was a huge awareness and huge interest by the applicants. So if you want to come and learn about how to use AI in healthcare, then please apply till 28th of May to Hello AI Rise online program. Getting back to Richard, so what do you think about, so a little bit coming to the point that how new skills need to be learned. So what do you think about the leader upskill process, let's say? So should the leaders upskill themselves and learn new technologies and, of course, new type of utilization of technology? What is their benefit, or what can be their benefit in this?
So it we know that especially in healthcare that most of the workforce or most of the people who make the decisions are way after the universities, and they are practitioners for a lot of years. And I know that it always a very stressful things to get this kind of new information in, even if it's your own field. It's kind of a lot of work to stay on top of your field. But I think that for anyone, it would be a very good intention to pick up AI, or at least in an informal way, that okay, let's just read a few articles. What is it? What can it do? Because we see even with our own partners from in GE Healthcare that the feedbacks are always positive from sites that decide to work with us or work with AI. So I have this message for medical leaders or medical leaders everywhere, that AI is a thing to be considered, and you don't want to wait 10 years where it will be almost mandatory to have it at every site. And now I think the leap is not that much, because the information is readily available with courses like Hello Iris. So a lot of there are a lot of things you can do to learn AI, and there are these packaged courses which are, I think, the best to start. And familiar with the course material, I'm confident to say that if you don't do anything, just do this course, you will get at the level of at least understanding what AI is. And if you want to build AI in your workflow in the future, you will get the basic knowledge on what you are doing.
I understand, absolutely. I would like to just remind our audience that you can ask your questions in the comment section. So as you know, the slide section is running on the Facebook and LinkedIn. So if you have any questions to us, please share it with us on the comment section. And if we just thought about the leaders and actually people who already got different type of medical or data scientist / engineer skills, what would you advise to the newbies? So whoever is interested at the moment on AI, didn't have any type of experience or chance to test their selves in the field of AI. So what would be your advice to these people?
Yeah, first is they are way luckier than every other people who are already in their fields, because at the beginning of your career, it's always easier to get up on the new trends and pick what is the best, and just learn that. So you are very lucky to be in this era where AI and machine learning is going up and up. And first, I mentioned that for engineers, it's always they have a leg up in AI. So if you're engineer students and interested in AI or in medical AI, you are pretty much good to go. You need to, of course, get some actual machine learning or AI knowledge. This course, Hello Iris, is good not just for medical leaders, experts. This course is, I think, it's completely applicable for newbies also. So there is no knowledge in this course which requires years of medical background. So even if you are engineering student or a medical student, you can apply and get to know the basics. Of course, after finishing this course, you will get a basic knowledge and the view on what's happening in AI, what's happening in healthcare. After that, it's really up to you what you want to do with it. If you want to pursue a career in data science, I suggest you take more courses after it, deepen your knowledge in programming, and get actual projects done in AI. It seems a little bit scary, it sounds scary, but there is a great community and a great public data community. There is a Kaggle website. I know that most people familiar with AI are also familiar with Kaggle. It is a forum where a lot of data sets are hosted and a lot of tasks and competitions are hosted. So if you get the basic understanding of AI and basic programming knowledge, you choose basic task in this site, and then you develop your own model, because in AI we see it with a lot of applicants for jobs that tons of people have the basic knowledge, but the ones who stand out has some finished projects behind them. And you don't have to work at a company to have finished projects, because there are available projects which can be done even by yourself with one-person projects. So do that, and don't be discouraged because of the field you want to work with it. So, for example, an engineering student can work in medical AI, so you don't need to be a medical student. Of course, medical students can also work in medical AI. So it's an interdisciplinary field, and we don't require from engineering students to have anatomical knowledge, because it's kind of it would be a very high standard to expect from everyone that, okay, be familiar with AI, be familiar with medical imaging and anatomy. So if you do one thing right, you can be part of these interdisciplinary teams like ours.
Thank you, Richard. So whoever just joined to us, let me remind you what is Hello AI RIS. So it's a 10-week online course regarding medical imaging. So the utilization of AI in the healthcare field. You can learn from the basics to the advanced knowledge from experts of GE Healthcare, University of Stockholm, University of Leitat, University of Debrecen, and University of Maastricht. So that's absolutely we can say, and I would be interested in your opinion, because how I see it's a unique opportunity for students and whoever is actually just interested in AI in the medical usage. But I would be interested in your opinion. What are the three? Let's just focus on three differentiator from any other AI course which can be available for students or newbies.
I think the first and most important, this is a course focused on healthcare, and I don't even know any other courses which are focusing on healthcare. so most of the other courses are focusing on very easily available public data and tasks, or sometimes automotive, but not healthcare. So if that's your interest, I think this is your course. The second, that it has a programming a starter course in programming, because most of the times you need to, and you start these courses and you realize that, okay, I will need to get a programming course first and then go back to this course. And sometimes it can be a little disheartening to, okay, I don't know any programming and need to go back. In Hello AI RIS, you will get the knowledge required to understand the course material and the exercises at the beginning of the course, which is very good, because so this course is useful by itself. You don't need to do tons of courses before. And the third is that it's highly interactive, because apart from, of course, the lectures and the materials, you will get live sessions, you will get virtual cocktail hours with the hosts. There are a lot of, not just 1-2 teachers, there are a lot of hosts, like you see these logos, these partners, that even from GE Healthcare, I think I and 2 of my colleagues were always ready to answer the questions. So you will get a lot of experts ready to answer your questions, which is always good. Not just to wait for that 1-2 teacher to have the time to reply for 100 questions. So here there are way more hosts, so the communication is much fluent.
That sounds really good. Before we are turning to the questions which has been published by your audience, let me remind our audience that this conversation will be available on our Facebook and LinkedIn pages after the live event and can be followed up later on. Of course, I would like to encourage you again to check out our education programs at EITHealth.eu, at innostarter.eithealth.eu, or if you are specifically interested in Hello AI RIS, then please come to helloaionline.com, or you can also find here the direct application link if you're interested in becoming a participant of this program. As I mentioned to you, we are hosting approximately 500 participants this year. The application deadline is 28th of May, so you still have time to apply to the program. If you're interested in AI and would be interested in using AI in medical fields, then we would be more than happy to host you in our program. So let's see what we have as a question from our audience. So let me grab some of these questions. Okay. Yes, you already replied to many of the questions in advance, Richard. So that's good. One of the programs that yes, so does it require a fee or it's sponsored? So that's one of our questions. Richard, should I answer for it, or would you like?
I think you are so you should answer this, because I know the last time it was free.
And it is. So my answer would be also really short, because that's a free program. So we are hosting all the participants for free, so there is no fee which is connected to the program. Okay, next question. Which are the programming languages? That's pretty suitable for you, Richard.
Yeah. So the one language which is applicable for 95% of AI jobs and AI tasks is Python. So Python and all the connecting things in Python, like Jupyter notebooks and all the Python libraries like NumPy and TensorFlow. So all these things are originated from Python. So
okay. Thank you for that. Next question is this program only for students?
No, we talked about the leaders who also want to skill up themselves. This course is good for starting from students. Even if you are still in university, you can understand this course material, because this doesn't require the most advanced background knowledge. So if you has the basic mathematical or the basic intellectual skills, and if you are a student, you will already have the basic skills to understand lectures and understand materials. You can apply for this course. But if you are already a practitioner, a software engineer, and already a practicing data scientist, because you can be a data scientist in automotive or other industries, and you are just curious about what happens in healthcare, or if you are a working medical doctor or nurse or anyone working in the healthcare, you can go to this course and go through with it. Of course, if you are a non-engineer, you will need to pay close attention to the first modules, the programming modules, to understand all the materials. But even then, I think the main message from this course can be understood without programming.
Absolutely. Yeah, and we only have time for last question, unfortunately. But of course, I would like to highlight here that all other questions will be answered by us through Facebook and LinkedIn comments. So whoever is still writing a question, don't give up. We will get back to you with the answer. Just unfortunately, we have limited time in our session. So just a last question, that is it only limited to students in risk countries? If you don't mind, Richard, I would answer for this question.
Okay.
So how Richard just mentioned, not just students, first of all, so that's an important thing that we can assume or we can summarize that everybody who is actually interested in AI technology in healthcare would be absolutely an ideal applicant for the program. From geographical point of view, yes, this is only concentrating on risk countries, meaning that Central, Eastern, and Southern Europe. But for the full list of the countries, please check out helloAIonline.com, and you can find the eligible countries. So if you're coming from those countries and interested in AI in the medical field, then you are an ideal applicant for the program. Richard, thank you for your contribution today. It was a really nice talk with you. I believe that we can give some really useful and interesting highlights and insights of the program, and also how AI seems to be on the healthcare field, and why it is really, really important to improve ourselves as a society and as an industry to keep up with the trends. So thank you for being here, and again for the audience. We will come back to you with our further answers. If you didn't find the answers so far in our session, that we will come back to you. I hope that you enjoyed our session, and please do not forget that we will come back to you with every month with a new session of Rise to the Challenge with interesting new topics, which is of course connected to healthcare. See you there. Have a nice afternoon for all of you. Bye bye.